So we carry on with our big day. So catanastic children monitoring. So within the PMG framework, my name is Kateryna Bulavinova, who is the medical UNICEF expert here in Ukraine. Those of you who are viewing us, so we are live transmission. So, and if you can see us well, so from the very beginning, so we have more and more people coming in the Zoom settings. Thanks very much for those who are looking, for viewing YouTube, Facebook, and YouTube. Thanks very much. That it is under the aegis of the Health Ministry, so NHSU UNICEF, so in partnership, so with the Early Birth Association, and with the support of the Children's Ombudsman from the President's Office, and with the help of the Association of the Nurses. So we'll have presentation, and after that, we'll have a short inclusion of Irina Kondratova to be able to take those questions that we failed to accommodate in the first part of the talk. So that is why, so get more questions to ask for Mrs. Irina. Our next speaker is Silke Mader, so who is the Executive Director of the European Council for the Neonatal Management, EFCNI, so what it takes to do service communication with the stakeholders from the
Silke Mader. I'm the chairwoman of the European Foundation for the Care of Newborn Infants, and I would like to thank you for inviting me, giving a talk about discharge management and follow-up for preterm infants, and why is it so important. I know why it is so important so well, because I'm a mom of preterm-born twins, where one survived and one passed away 1 week after they were born. This is a picture what I would like to share with you, because our children were born very early in week 25 plus 1. And in our time, 27 years ago, it was very similar through for example, like it was in the pandemic, that parents were separated from their children. There were just a few visiting hours. Parents were treated like visitors. And therefore, we really struggled from this burden of separation for a very long time. And this has also an influence on the long-term outcome of children, and also on how self-confident parents are when these children are going home. And I also talk here not only for me as a mother, it's also important to involve actively the father and both parents in this journey. And why it is, for example, so important to provide optimal treatment and care and inform parents about discharge management, about the nutrition pathway, is to show you this picture. So Lucas is the smaller one, and his cousin Fabrice next to him is 1 week younger than Lucas, but he is born term. And the nutrition pathway of both children were, of course, very, very different. Lucas was born very preterm, very tiny, long time in the hospital, not really having breast milk all the time. Nutrition was not individualized, organized at this time. And also my role as a mom, being able to feed my own child, was not really supported. So at this time, I learned to give him the bottle, because I had not enough milk, because I lost most of the milk, because I was not supported in breastfeeding. And therefore, even bottle feeding was supported a few days before I came home with Lucas. And that was one of the big challenges, that I had not really an understanding of what does this mean to feed a preterm infant. And also the products were not available at this time after discharge. So it has a long-term consequence how our children are treated, and how they are taken care, and how the discharge management is organized. And it is really important to understand that discharge starts when the babies are born. And therefore, it's important to have self-confident parents to be able to manage the time afterwards, really fully self-confident. It is also a challenge when they are coming home and have challenges like our son had. He was not starting to scroll or to walk. So we realized this when Lucas was close to 2 years old. And also his hips we had a surgery when Lucas was 4. Both hips needed to be broken, and also 2 legs, because of having not really physiotherapy afterwards, not really proper follow-up. So I was more a therapist of my son as I was a mom. And this is why I want to start this presentation, also to understand why it is so important to provide really a fully good organized discharge management, which starts really when the baby is born, that parents are self-confident, that parents really know what this child needs and where they can get the need of the discharge, because this is, especially in your situation at the moment during the war, I mean, a very, very big problem. Nothing to be able to compare this with our situation at this time. But it gives you maybe a better understanding on what is needed that these children really can thrive. And to understand also what are the needs for standards of care, and also what are the background information of the European standards of care for newborn health in the follow-up area, that is something what I would like to share with you today. When we talk about preterm birth, parents have mainly not expected that their babies are born preterm. They have a totally different vision, and they don't understand what will come when they are in this situation where the babies are born preterm. They are in a really shock situation. It is a roller coaster trip, what many parents share with us. We even don't know if the baby survives, how the baby survive, and if the baby survive, what kind of potential disabilities will come up. And even you often don't know, even when a child has a PVL or a brain bleeding or anything else, we don't know how the outcome is. And the influence of the parents is enormous. Evidence shows that especially the education and background of the mom has a huge influence of the outcome of the child. And therefore, it's important to really have self-confident parents who know where we can find support, where, for example, therapy is available, who is paying which therapy, and what needs to be done also at home to really support the child as much as possible. And so parents are not all the same, as you for sure know, and but it's often the case that we are treated the same way. Parents who have a very good educational background, university degree, or having a special education like a teacher or psychologist, in my case, I'm a preschool teacher, we have a general big knowledge about development of a child. When you have challenges, like in your situation, being in the middle of the war, being maybe poor or taking drugs, being very young or being a single mom, they have different challenges. So they need more support quite often, like you would have a stable situation of parents where they are well educated and also can maybe financially support their child's development and paying such kind of different kind of therapy themselves. So here it is really important to understand the individual needs of the baby, but mainly also of the parents, and what kind of information they need to really be able to handle when the child is going home and everything is prepared, and especially the follow-up and is organized, where is a doctor who can take care at home of the child, which kind of therapies are available, how often I need it, and so on. So when they are going home, it's not only a moment of happiness. I really struggled when we went, when they told us we are going home. I had not really an understanding of what will come, and totally naive, thinking that now everything is fine. But it is not the case, because the care in an intensive care, what you are used before, is cancelled. So you are alone with everything at home. There are demands on yourself, others have demands on you, and there is a lot of emotional stress when the child is going home. There was a long separation from the child, and from one day to the other, you are responsible alone for it. So there is a lot of complex care for such a child. Maybe there is a monitor, maybe their baby is not sleeping, the bonding is difficult. You have, of course, a lack of sleep, what you are not used, maybe being used before. And you have problems that the baby is sucking, takes enough milk, and it's a very stressful time. So when you have technical equipment at home, how to handle it, how to get it, that are really big problems. And also what I experienced a lot was social isolation, because I didn't want that Lucas gets an infection. We had rehospitalizations, and that isolated me from all these other moms who had a healthy baby, and they always said, oh, that's not a problem, that's normal. But it wasn't, because I had a child born very preterm and had different problems as others. I had often the feeling that I'm not a good mom, that I really be not able to handle everything. That are things where parents are struggling. And what's really is a big burden is the unclear prognosis, because really knowing that everything is fine or not fine develops in the first 6 years of life. And you don't know this from the very beginning. So therefore, the parents, and both parents, not only the mom, experience mental and physical exhaustions, and that challenge of course, also the bonding process. So when we talk about long-term and best outcome for these children, what we all want, we know that many of these preterm babies have later on different kind of disabilities or problems in their life. And when we talk about this, we also have to be realistic what means this in long-term outcome. So reduced educational attainment, for example, when there is no support provided, the parents are potentially not able to support, or in situations where there is not a support possible, then we, of course, struggle with all these issues, even up to poor adult health, reduced social integration, or earning potentials. And this is what we, of course, don't want, because when we talk about worldwide 10% of born premature, 10% of our society would have the risk of all these issues. And that has a huge impact of the society. And none of us really want to have such a big risk. And therefore, it is important to see what can we do to reduce these risk factors tremendously to ensure that these children can really thrive, not only survive. So therefore, we have developed, many of you know for sure, our European standards of care for newborn health. And for us was important that we not only talk about the time in the NICU, we also talk about the time when the babies are going home and the parents are not alone. And therefore, we also had the follow-up and continuing care package with a lot of individual standards. And I start here with a standard which is not in this package, but as I told you before, that it is so important to start really before discharge. It is important to develop with the parents together and your team an individual case management plan for every single newborn. So that means a plan when the baby is going home until this time, what the parents, what this child needs to develop, what is important for this baby and for the family. And this needs to be developed together with the parents, that when they go home, they are really proper prepared. This is why I start with this standard, which is in the Infant Family Centered Development Care Package, but it belongs for me and for many of us parents, but also healthcare professionals, somehow in between. And therefore, I want to start with this. When these children are going home, what is really needed to ensure an optimal, best possible outcome? Therefore, the follow-up standards were developed. And when you see here the child, that is, of course, what we would like to have, a healthy little boy who is able to communicate, who is able to walk, who is able at the end to see proper, to hear proper. That is what we would like to have. How can we ensure it? So therefore, the transition to going home is one of the key issues. So families receive a comprehensive discharge management plan. So what I said before, when they start, when the baby is born, and they are going home with this plan, and have really a kind of guidance, a kind of checklist where they are really going home and feel good prepared. When we are going home, we need often at home also support. That means case managers who are coming home when there are high-risk infants after discharge. Maybe they need monitoring and several other issues. That is what really is needed, and therefore this needs to be organized and coordinated before the child is going home, and not 1 or 2 days before. That's much too less time to really find the right person who is taking care of the child when they are going home. So the medical care, maybe care support, any kind of therapy, what this child needs, that needs to be coordinated far in advance. When they are coming home and they have a lot of problems or had a lot of problems in the hospital, a lot of maybe negative experiences, diagnosis, they need support at home. So that means parenting programs, feeling like the parents and feeling like this is their baby, and they can manage this. It can be psychological support, it can be social workers. There are different kind of programs available. I know that in your situation, it's very challenging at the moment, but maybe digitally is something possible where parents can communicate and get support. It is important to talk about vaccination, immunization of the preterm babies. We know that babies born preterm, many parents are worried about vaccine their babies. They have anyway already so many experiences with needles. It's really important to inform the parents, to tell them what is needed, which kind of immunization is needed, when to start, when the baby is very preterm. And that's something what parents need to know. And also the pediatricians who are taking care afterwards have to have a letter from the hospital to really get the right information. There are a lot of topics now where I know that this is not available everywhere, but we are recommending having a hearing screening for every baby born preterm. In Germany, for example, it's even for every baby born that hearing screening is available. But I also understand that you have challenges to really provide the support. But if possible, please take care that every baby, even not preterm, gets a hearing screening. Also visual function, I can tell you my son had an ROP and we are still, he's 27 years old, in the ROP follow-up, which is known in the meanwhile that ROP is not just disappearing. It can come back when the children are teenagers. So therefore it's important to have regular follow-ups for children born preterm and having a high risk of getting an ROP. Cognitive development is important to have standardized cognitive assessment with the pediatricians, but also there are special institutions who are taking care if the cognitive development is in line with a baby born in time. Speech and language and communication. It's important that parents understand that they should talk a lot with the child, that that they make assessment, of course, but also how to support the child, that the speech, that the language can develop. This is why it is so important to have good, well-educated parents, good organized, that they understand why it is important to have a good support in developing the language and the speeches. Healthy lifestyle and cardiovascular diseases. Preterm babies have a higher risk getting later cardiovascular diseases. Therefore, it's important to have follow-up, even with very preterm babies lifelong. It's important to have cardiovascular checkups and to ensure a healthy lifestyle and a lot of course, healthy food. Mental health aspects are on both sides important, not only for the parents, also when the children are growing up and they are smaller, more thin like the others, or maybe more shy, have problems to not underline the mobbing situation. That is something where we also should inform the parents. We should observe this because that is one big risk factors when babies born preterm because of the physical development that potentially they have later experience with other pupils to experience mobbing. Motor and neurological follow-up assessment is something which should be standardized until the age of 6 to have assessment there in special centers to see if there are any kind of motor or neurological delays in the development. Therefore, checkups are really strongly recommended. Respiratory outcome, it's the same, like I said before, with cardiovascular diseases. It's important to really have checkups until adulthood or even later, if possible, regularly, to see if any kind of respiratory health outcomes are delayed or have problems. Children born preterm have a higher risk of getting asthma. They had, many of them had a BPD. Therefore, it's important to really take care of the health of the lung lifelong. Mental health problems occur quite often with the parents. Both parents, I always say this, it's not only the mom, it can be both who can have challenges. In our case, we also had it both. Even my husband had a huge tinnitus where we struggled a very long time. And until today, my husband cannot talk about the time when we were in the NICU. And so don't underestimate the challenges what also fathers face. When our parents had a preterm birth, potentially they would like to have a further child. Therefore, it's very important that especially women who had a preterm birth and we don't know why they had a preterm birth, or in my case, I had a preeclampsia, they really get a reproductive counseling and also a long-term follow-up, especially when they were the reason why the baby were born preterm was a preeclampsia. Here we know that cardiovascular diseases, kidney diseases, and so on can occur later on. Therefore, a follow-up of the mom, and especially when they want a further child, should have a reproductive counseling. Special needs at school. Of course, you are neonatologists and neonatal nurses. School is far away, but it's important that we find the right school for the child, that they really get support before they start schooling, and to look what kind of needs they still need to really have success at school and are not isolated and are supported on the needs of the individual child. So to implement at the end, there were a lot of standards and follow-up, and in total we have over 100 standards. It's a challenge. We are fully aware on it, but we know that Ukraine is already working hard in implementing standards, even in your situation of the war. So many aspects we are working at the moment on it. And what is really important is to start, to not say that's not possible in our situation, that's not possible for us at the moment. And not all of these over 100 standards can be implemented at once. Therefore, it's important to look and to check and work together with parent organizations, with societies, and with, of course, the governments. What can be afforded? What can be realized? What is something what is quite cost efficient and cheaper than other things? And how can even digital solutions can help at the end an implementation process of the follow-up standards here in this case. So feel free, if you have questions, to reach out to us. And I hope that I could give you some good examples what you could start to implement. And I would like to close my presentation with a quote of my son, that babies born preterm do not only have a tough time during first days or months of life, preterm birth may affect us and our family for a lifetime. And just this last year, Lucas had 3 surgeries, laser surgeries on ROP, and we are on checkups regularly for the lung, for the heart, to ensure that Lucas really can thrive and can really make his life a happy life. He just finalized his master degree, is waiting of his PhD position. So being born preterm with 515 gram and having parents who are putting a lot of effort inside, give these children really a chance. And with the support of you, the healthcare professionals, we can work together to make it possible. Thank you so much for your attention.